Why I research? I started out because I was placed in an organization where Dr. David Hall, that was his primary area of research, the correction of temporomandibular joint disease using surgery. And I did that for 33, 34 years until I decided it was not effective, at which point I felt that I had enough broad background, which is why I explained my prior experience and training in both dental and medical school, NIH, research fellow, facial growth and development, that I had enough broad experience where I could take a look at it without all the bias that the dentists bring into it, the bias that the surgeons bring into it, and take a fresh look at it and really find out, with the help of my patients, because they're the ones who directed me to where to look, by saying a simple phrase a dozen times by a dozen women. If I put my finger, my tongue, a pencil eraser between my front teeth, it feels better, which eventually led the research in the direction of designing a device and protocol that does nothing more than sit between the front teeth, separating the posterior teeth, allowing the inflammation in the temporomandibular joint to decrease to the point where these symptoms go away. That is a brief discussion of exactly how it all came to be. And then why I want to teach about it is really simple to talk about.